I'm Nikki Armstrong, nurse practitioner from Armstrong Telehealth LLC. I offer virtual primary care and urgent care type visits for a flat fee of $60. Today I'm going to talk about hair loss treatment options. So treatment options can be anything over the counter, and we'll talk about those. And we'll talk about prescription ones too. I'm happy to help as a nurse practitioner. If you're in the state of Kentucky or Wyoming, you can book with me, and I'm happy to either point you in the right direction or recommend over-the-counter options versus diagnosis versus, we need a prescription or even a referral to dermatology. Topics we'll cover are going to be very generalized types of hair loss. I'm not going to cover the rare types or like the non-scarring or the scarring alopecias that are permanent. I'll show you some pictures, but that's about it. We'll talk about what the different types look like, what causes them, and then, of course, treatment options. First, let's talk about what's normal. So 50 to 200 hairs per day is what we typically lose. Here in this picture, I counted out 100 of me and my daughter's hairs, which wasn't very hard to do, actually, between the two of us. And you can kind of see the thickness of it. And we're both dark brown hair, so you can see the thickness and compare it to that pencil, the big school eraser there. That's normal. Yours may look different based on length. So if you have really long hair, 100 hairs may look like a ton of hair. So just keep that in mind. And then there are 3 causes of hair loss. There's disorders of hair cycling. The hair cycle is the growth phase, transformation phase, and rest phase. Rest phase is when your hair falls out. And your follicles go through these phases at different times so that your hair doesn't all fall out at one time. There are also inflammatory conditions that damage follicles. That would be like syphilis or ringworm. There's also inherited or acquired abnormalities of the hair shaft. So inherited would be like those babies that are born bald and then they just don't grow hair forever. Their hair is really thin, and even at 1 year they don't have a ton of hair. They're usually blonde, and their hair breaks super easily, so it makes them look like they don't have a lot of hair. But usually this resolves at about 4 years of life, and that is definitely genetic. Acquired abnormalities would be like split ends or damage from heat, curling irons, bleach, things like that. So disorders of the hair cycle, there are 2 types, the scarring alopecias and non-scarring alopecias. Scarring alopecias are permanent, and it's going to be treatment you're going to get from a specialist. So if you look at the pictures here, like this poor guy definitely is getting a referral to a dermatologist. I'm not going to try to treat that, nothing. But like this one here, that looks like an infection. I would probably put you on antibiotics for this one and, check into some like MRSA or tick-borne disease or something like that. Or these here look like ringworm or a fungal infection from a haircut. So you may be treated with a couple of different things before you get a diagnosis, because those things aren't going to help these because they're not what they look like. You're only going to find out through a biopsy, which, would be usually a dermatologist that does the biopsy to diagnose these. I'm going to talk about today the non-scarring alopecias, where they're temporary. Regrowth usually happens spontaneously. Sometimes they need treatment. The first one is alopecia areata. It affects 1 in 1,000 people, so pretty common. It can start in childhood or adulthood. If it starts in childhood, their risk of having chronic problems becomes higher. Whereas, most people with alopecia areata will have a recurrence, but they don't necessarily have it all the time or have chronic problems where they have total hair loss. Other things that can put people at risk are if they have severe disease. So it's not just a patch like in this picture, it's like the whole head where they've lost greater than 50% of their hair. If they have nail involvement is another risk factor. If their hair loss lasts more than a year, that's also another risk factor that they're just going to have a chronic problem. If there's a history of alopecia areata, the risk is also higher of chronic disease. So alopecia is usually, it's a genetic thing and it's brought on by stress. Regrowth without treatment is common, but we do have some treatment options. So this can affect your eyelashes. See how they're missing their eyelashes right here. It can also affect eyebrows. You can have patchy facial hair loss. And then this poor kid, I'd call that greater than 50% hair loss here. This is what it looks like then when it affects the nails. As far as treatment options, if you have less than 50%, or even greater than 50%, you can always try, there's always wigs and hair extensions, things like that. But, you can always shave your scalp. There's protein powders and sprays or lotions that make your hair appear thicker or fuller. And then, of course, you can get your eyebrows tattooed or use makeup or use false eyelashes, whatever works for you. But we can also inject those if you've got a patchy area. We can inject it with steroids or prescribe some topical steroids that may stimulate growth a little faster than just leaving it alone. If you have, like that poor kid in the previous slide, greater than the 50% hair loss, you're going to probably need some immunotherapy if you want treatment at all. And that's going to be a specialist or like a dermatologist. The next type of hair loss we'll talk about is the most common type in men. It's male pattern hair loss. There is a genetic component, and it's caused by high levels of dihydrotestosterone, or DHT. DHT is what makes a man male. So once they hit puberty and it's completed and they are an adult male, they don't really need DHT anymore. They need testosterone. The problem is they have a genetic inclination to turn testosterone to DHT. And this is important because the treatment options we affect that conversion. So treatment options are going to be the finasteride. Finasteride is a pill you take every day. It keeps the conversion of testosterone to DHT. So there's less of it in your system. So that keeps you from losing your hair. It can also, we use it to treat prostate problems, because if you have high levels of DHT as an adult male, it enlarges your prostate. And then over-the-counter options are going to be minoxidil, which is Rogaine. So there's two different types of Rogaine. The concentrations of 2.5%, which you use twice a day, and then there's the one time a day 5%. The 5% actually have less side effects as far as like rash, itching. And it's only once a day. So I do recommend the 5%. As far as efficacy, they both work about the same. And then the only permanent option, because the other two options, you only get the effects while you're using the medication. Surgical hair replacement is going to be the only permanent option for male pattern hair loss. So the next type is female pattern hair loss. We don't know as much about female pattern hair loss. Is it from increased androgens? Because we see it sometimes in PCOS, that they'll have really thin hair. But not everyone with female pattern hair loss has PCOS. So we don't know that that's what the cause is. And then is it a genetic cause? Is it some of both? Unfortunately, we just don't know. Most of the time it does happen after menopause. So we think maybe it is hormone related. Female pattern hair loss, you can tell the difference from other types of hair loss, because usually it will spare the hair around the face line. Okay, so it'll start with your part a little bit thicker here. So it'll be a thinner part, and then it'll go back in a Christmas tree type pattern. So really you're losing hair at the crown of your head is all that means. Again, so it spares, she's got good bangs, and then it just gets thinner as you go back. So again, you can use the over-the-counter cosmetic options. There is female Rogaine, but you can use the male. It's the same. Again, I recommend the 5%. There's also oral minoxidil. Usually that's going to come from a dermatologist that prescribes that one. But primary care, right now I'm happy to prescribe the spironolactone. Spironolactone actually decreases androgens. We use it to treat PCOS, which, women with PCOS can have like facial hair and acne. And spironolactone decreasing the androgens will help with all of those things. So we can try it with female pattern hair loss. The problem with spironolactone is we also use it for high blood pressure. So in a woman that doesn't have problems with high blood pressure, even like borderline low on blood pressure, if we lower their blood pressure more, they can feel tired, get dizzy when they stand up, things like that. And if those side effects are too much, we can try finasteride. Again, that works with DHT, which which may work with a theory of PCOS and increased androgens. It may not. There's also laser light therapy treatments which stimulate hair follicle growth. The oral minoxidil, and then the hair transplant again is going to be the only permanent option. The other things, you have to use them for them to work. All right, another super common one is telogen effluvium. This is from a major physical or psychological stressor, or sometimes, in about a third of the cases, unfortunately, we don't know what causes it. And you may just have a phase of thin hair. Hopefully it's just a phase and nothing more permanent. But childbirth is one, yourself or your friends or whoever, they lose a ton of hair about 3 to 4 months after delivering a baby. And you really notice here in the in the angle of their forehead up here where it gets thin. That's usually where you'll notice it first. Sometimes it can be pretty significant. This poor woman's got it, everywhere. But rapid weight loss is another one. So if you have someone that has had a gastric bypass or is on medications to rapidly lose weight, that definitely puts a lot of stress on the body. It's not necessarily the actual surgery or the medication itself. It's the, decreased protein, vitamins, things like that it just puts a lot of stress on your body and you lose your hair a few months out. When those problems are corrected, it should grow back. Medications and supplements are another super common one. And really, some medications you're just going to have to take because you've got something serious going on or it makes your life a little bit easier or better, and you want to stay on it. There are, you can try things like Rogaine, but again, that Rogaine can make you actually lose more hair before you grow it because you're kickstarting the growth cycle, so it's pushing out old hair. It's like when your cat sheds every winter or your dog. And then acute chronic illness. So I see this a lot with COVID. A few months later, they'll lose hair, and it can be significant with COVID. Another one is thyroid issues. If it goes too high or too low, your thyroid definitely can affect your hair growth or loss. Treatment options, unfortunately, we're pretty limited. Cosmetic over-the-counter options like the sprays, lotions, shampoos that make your hair look a little thicker. But really, the treatment is going to be finding the cause. Again, a third of the time, we won't find anything. We can get all the blood work and everything come back normal. Hopefully, it was just something that is a phase and it will grow back on its own. The next type is the trichotillomania. This is an anxiety behavior. Usually I see it in kids, and it's usually eyebrows, eyelashes. It can be on the head though. Some people will pluck their hair out as like a nervous tick almost. And it's one, so if usually parents know that they've lost their eyebrows because they've seen their kid pulling their hair out, or their teacher told them, that they're pulling, and usually that's going to be a counseling referral. Traction alopecia is another very common one. If you have your braids too tight, or even if just wear a ponytail all the time, that's just too tight, or you put your wet hair up when it's weaker, in one of those tight ponytails, around your hairline or wherever it's pulling, it breaks the hair. That's an easy fix. You just don't put your hair back for a while and let it grow out. It's just damage to the hair. Well, thanks for listening today. If you guys have any questions, feel free to leave a comment, or you can message me on my website. I'd be happy to get back with you. And again, I'm happy to see you if you're in the state of Kentucky or Wyoming as a patient. I charge $60 flat fee per visit. You can book yourself online at www.armstrongtelehealth.com, or give me a call. I'm happy to book for you, whichever is easiest for you. Again, thanks for listening and have a good day.